everyone, so I'm back with another vlog. Today I am going to be answering all the questions that you guys asked related to my course dentistry. So I think first week of September I posted on my Instagram account if you guys can ask me any dentistry related questions, and surprisingly a lot of you guys were so curious about my course. So I am going to be answering all the questions first related to my course dentistry, and then later I'm going to be sharing how I organize and fix my dental materials here in my study room. So the first question is, why did you choose the course dentistry? So when I was in grade school, I still remember and I knew deep down in my heart that I really wanted to take up any medical courses, but of course I wasn't specific about that path. But then when I was in senior high school now, that's the time I really have to make up my mind on what course I wanted to take up for college. And my mom suggested maybe I would want to take up the course dentistry. So what I did that night when my mom suggested to me the course dentistry, I was doing a lot of research about it. The dental health is just as important as our overall health. So for instance, when I have to deal with my future dental patients, there's a lot of options that I can present to them, like in terms of the prevention, the treatments. You can never run out of options, and that's what I like about dentistry, because in the field of our work, there is continuous innovation and discovery in terms of the technology and all the machines that we can use in order to restore our patients' smile and teeth. The second question is, why did you choose CEU? Is dentistry your first choice of program? Like what I told you earlier, I know that I wanted to be a doctor, but then when I was in senior high school, there's this one course that actually confused me if I really wanted to take up that course or dentistry. So that course is in international studies. Of course, I still end up choosing dentistry. Why did you choose CEU? So to be honest, CEU was not my first choice, but I took UPCAT exam in UP. But then unfortunately, I wasn't able to pass the CAT. I still remember the time that the UPCAT results came out. Kasama ko yung mga St. Paul friends ko, and we were in Intramuros. We were shooting a film for a project, and then when I found out that I didn't get in, I was so sad about it, and I was just waiting for us to go home already. And then when I got home, I still remember taking a bath while crying. So I think I cried for like an hour or more pa. But then I realized na if it isn't for me, why should I force it? And there's a lot of school here in the Philippines that offers a really good dentistry program also, so why not? How do you manage being a dentistry student and being a vlogger at the same time? So when I started my own YouTube channel, that was the month of July, so bago pa lang, and that time it's my vacation, so I had an ample time to vlog about a lot of things, a lot of stuff. The last vlog was posted around August, so it's been a month since I haven't vlogged kasi nga my online classes started, and during this time I was quite realizing na I really have to manage my time well, kind of challenging. So right now I'm just gonna vlog kapag may time lang talaga ako, kasi my priority is my studies. Of course, I'm on my first year of Dent Popper, third year college, so I really have to take things more seriously now kasi all of our subjects are all dentistry related already, and I'm taking up all the majors. But I'm still gonna try my best to film and share my dental journey as much as I can. The next question is, how do you see yourself practicing as a professional? Maybe when I started practicing my course dentistry, when I became a dentist, I wanted to be more well-spoken about all the treatments, all the diagnosis. I want to attract them through my knowledge, and that would also give them the sense of trust. They would trust me, and in our field, kasi it's important to be able to impart trust between the dentist and the patient, because of course we are dealing with a very sensitive part of the face, and that also includes the oral health, our teeth, and our goal as a dentist is that we would want to restore our patient's smile, to boost their self-confidence question is, paano po ba nabubuo ang teeth? Us, we undergo two types of teeth. The first one is the primary dentition. So around 6 to 12 months, our primary dentition would start to erupt. So the primary dentition is also referred to as the deciduous teeth, or what we commonly known as the baby teeth. And this will continue to erupt at the age of 1 to 3 years old, wherein the posterior molars would be the last one to erupt. And then this is where the 20 primary teeth will be completed. So around 6 to 12 years old, this is the time wherein the primary or the deciduous teeth would start to be replaced by the permanent teeth. So dito na papasok yung succedaneous teeth. So what are the teeth or the tooth that is considered to be succedaneous teeth? These are the incisors, the canines, and the premolars. Molars are not considered to be the succedaneous teeth or no prosthesis because it would start to erupt on its own. Okay, so lastly, around 13 to 21 years old, this is the stage wherein the 32 set of permanent teeth will be completed. And this is the time wherein the third molar, or what we call the wisdom tooth, would start to erupt. So if the third molar is impacted in a horizontal manner, then that would have to be extracted and removed immediately in order not to cause pain and to prevent overcrowding. Bakit po kinakausap ang patient tuwing may tools sa bibig? This is actually my question also for most of the dentists. When I was still young, because there's this one dentist way back in our province na every time na I'm gonna have an appointment with her, she started asking question when your mouth is filled with lots of dental materials. No? So it's really hard to respond with all of that dental materials inside your mouth. There's a lot of patients who have dental anxiety. They don't want it to make it obvious. I think that's also one of the strategy and ways of the dentist to comfort and to calm their patients. The next question is, are veneers recommended for young adults? Okay, so I'm still in my third year, and to tell you honestly, we haven't gone into these topics yet thoroughly. However, I'm gonna answer this question based on what I know and what I read from my past readings, of course, from a credible source. So, from what I know, there is no certain age. However, the dentists and most of the professionals would recommend their patients to acquire veneers at the age of 18 and above. Kasi this is the time wherein all the permanent teeth is already completed. It is important to have the complete set of the teeth before doing this treatment so that there would be no alignment problem that you will encounter in the future. Okay, so my friend is calling me, so I'm gonna leave out in a minute. It is only recommended if you really have damaged teeth, crooked teeth, or like you really have a bad discoloration on your teeth. This is really recommended. Do a lot of researching first before you acquire this treatment. Yung veneers ba, required na whole set yung ipapalagay? I have a lot of family, relatives, or friends who have undergone this procedure already, and most of them, they do this for aesthetics. So, they don't acquire whole set veneers, but rather they would only require all the teeth that can be seen when they smile. Like here. For example, maybe here, they would only acquire up to the canine, or like up to the first premolar that can be seen when they smile. Maybe 6 from upper, and then 6 from lower also. Why am I doing this? It is not recommended to damage all of your teeth with veneers. If it's okay naman, then don't. I have the triangle of death gum in gums between bottom 2 teeth. Anyway, the Philippines, the best thing to do there is orthodontic treatment or filling treatment. Why do you have to study general sciences in dentistry? So during my first year and second year, I studied general sciences like general anatomy, zoology, genetics. Also studied about histology and embryology, like that. I think it's important to study general sciences in dentistry because it would foundation, and it's really important to be able to have knowledge about these things also, and not just to focus on our field, dentistry. Everything in our human body is interconnected. For instance, the important topic that we have studied in general anatomy are the cranial nerves. So it's important for us to know about the different types of cranial nerves, especially the trigeminal nerve, because this consists neurons that sense and transmit signals, informations regarding the mastication process and the overall oral health. For example, when future patients would come to the clinic to acquire tooth extraction, of course, you have to inject the local anesthesia properly. For example, if we are not being careful in injecting the local anesthesia, this will put the patient's health into danger. If we hit the olfactory or the optical nerve accidentally, that would cause problems on the patient's eye, sense of smelling. It's really important to have a foundational knowledge about these things. Okay, so the next question is price range and what are the essential dental supplies and equipment needed for a dentistry student. During my first year, wala pa naman kaming ginastos regarding sa dental materials, but then second year, that's the time that we started spending for our tooth carving materials in our oral anatomy. And then this third year, which I'm gonna be studying and doing lab works already in dental materials, I think I spent around 40K already for this lab dental materials. Kasi in-include ko na doon yung mga extra, like extra alginate, all the powders, dye stone, dental stone, plasters of Paris, and all that. So, everything is included there already. It depends actually kung saan ka mag-extra kasi yung ibang dentistry student, like, they are really artistic. However, for me, kasi in my case, I'm not really artistic, so I really have to practice to make it perfect. So, for me, I bought extras talaga. That would also save me money in shipping kasi ayoko nung kaisa-isa. So, mas okay na sobra kaysa yung kulang. Tapos during lab activities, so what if hindi ko siya makuha in one try? So, wala na ako ng materials na yun. So, I have to make up for it. So, malilate na ako. So, it's much better to gonna have extra materials talaga. How is your experience with manipulating impressions? Okay, so since we haven't started yet, maybe I'm gonna be answering that question once na-experience ko na siya. Kapag nababaliw ka na sa dent, ano yung most common phrase na sinasabi mo to yourself? Nababaliw. Nakakabaliw nga ba ang dent? Pero seryoso. Nababaliw talaga ako. The first challenge that I encountered sa course na to is during second year, online classes na kami doon. So, when we have to do tooth carving and drawing at the same time. Drawing is not just a drawing, but that drawing also involves measurements. So, hindi ka lang dapat mag-focus sa aesthetics, but also into the technicalities like the measurements and all that. So, for example, nung nag-tooth carving ako, I still remember the time na I would carve 7 to 8 hours a day, tapos isa or dalawang tooth pa lang yung nagagawa ko. And hindi siya perfect pa, kasi mahirap talaga. Especially if it's online classes, the prof would send videos and their tips and techniques to you, but it's just really challenging for me. This is from my own personal experiences. So, during the time being, ang dami ko nang pinapanood sa YouTube kung ano yung mga techniques and tips, but then I still end up crying kasi hindi ko siya makuha. This is the phase wherein mapapasabi ka na lang na help me God and kaya ko to. Yeah, that's actually the most common phrase na sinasabi ko kapag paiyak na ako, kapag nanginginig ako na yung luha ko. Kaya ko to, tapos mapapatawag ka na lang kay Lord. Help me God, help me. It's reasonable. 7 to 8 hours ka na nagka-carving, tapos namumula na yung hands mo, pero nakakadalawang tooth carving ka pa lang. And then, madami ka pang kailangan i-carve. Next question is, during this pandemic, how do you survive dentistry life and how do you cope up? So, during this pandemic, of course, we have to adopt to the new learning environment na online classes, both synchronous and asynchronous class. For me, it's really challenging and hard kasi dentistry student ako, I have to do hands-on activities and I really have to have an instructor who would guide me, who would tell me na this is what you should do, this is much better. So, feel ko yun yung kailangan namin as dentistry students, yung comment ng dental instructor on what we should do, even though we know how it should look like. Also, I would just like to add that in our course, dentistry, we have to learn how to be more independent in terms of studying, doing your own lab work. Kasi sa dentistry, kapag ikaw ay naging professional dentist na, ikaw na lang eh. You have to be independent and kailangan passionate ka talaga sa ginagawa mo. Kasi nga, yun yung sinabi ko sa inyo kanina, kailangan magkaroon ng trust yung patient sa'yo. You are dealing with a part of their face na talagang nakikita ng lahat. So, you really have to show it to them that you are really passionate about what you're doing. So, how do I cope up? So, for example, if I am bombarded with a lot of schoolworks, I really have to talk to myself. Yeah, I talk to myself and motivate myself to do it now as early as I can so that if I really want to enjoy my weekend with my family and with my friends, I can do that. Kasi you also have to balance your social life and your academic life. So for me, kasi that's my motivation. I wanted not to do anything during the weekends and I just wanted to do schoolworks during the weekdays. Ang thinking ko din kasi is that I don't want to prolong the agony. So gagawin ko din naman siya kasi kailangan ko mag-submit. But of course, just don't submit. You really have to look into your content and to the quality of your work at the same time. In your personal opinion, gaano ka worth it ang dentistry? I think worth it naman ang dentistry kasi syempre pinaghirapan mo yan and it's a process. Like for me, alam mo yung feeling na when you continue to push yourself into your limits and kala mo hindi mo siya magagawa, like it's impossible for you to do it, but then at the end of the day, nagagawa mo siya. It's fulfilling, and that's what I like about my course. It helps you to be a stronger person that you could ever be. You can see your progress. And syempre, like for me, doing artistic works and all of that, and then at the end of the day, na-achieve mo siya. It's fulfilling. As a consistent scholar, how do you balance your dent life and your social life? Parang nasabi ko na ata kanina. How do I balance my ACADS or dent life and my social life? Like what I said earlier, mahirap din naman na puro aral-aral na lang, diba? That would cause you to burn out if puro aral, puro study na lang. So for me, I believe talaga na you have to balance your social life and your ACADS life as a student. And what I usually do is that I try to accomplish all my school works that have to be submitted at the end of the week during the weekdays so that I can enjoy my weekend with my family and with my friends. It's all about time management and sometimes sense of willingness mo to do things right away so that hindi ka na mahihirapan na mag-cope up. So of course, I have to tell you honestly, I still do procrastinate. Every time I procrastinate, dun gumagana yung utak ko. Like, ang bilis na lang. I don't know, there's something about procrastination that would just push you to type more, to think more, gano'n. Rate from 1 to pagod na ako sa buhay, Lord. Gaano kahirap ang dentistry? So, I think my rate would depend on the tooth carving experiences. So maybe I would just say it's 8. Wala pa naman dun sa pagod na ako sa buhay, Lord. Siguro magpapagod na ako sa buhay, Lord, kapag clinics na, ganyan. When I have to deal with real patients na. So yeah, I just really hope na I'll be able to survive this. What can you advise sa mga gusto mag-dent? So my advice for those aspiring dentistry student is that if you really wanted to succeed in this course is that you have to be responsible, manage your time well. You don't compare your work to your blackmates, to others, kasi that's your own work. Everyone is unique. Everyone has their own progress, their own improvements, and their timeline. So you just don't compare. You just really have to focus on your work so that you will not be discouraged. Kasi kapag nakakita ka ng ibang mas maganda sa work mo, wala na, magtutuloy. It's like a domino effect na magsusunod-sunod na yun. So you will feel unmotivated. It's just like what I said, practice being independent now and to study on your own. Since dentistry has a lot of requirements, do you procrastinate ba? Do I procrastinate? Yeah, I answered this one earlier na. This is where my brain is at the peak of functioning. A lot of us kasi, we have different styles how to do our school requirements. But for me, I weigh it out. Kaya ko mag-procrastinate if I'm confident in myself na kaya ko siyang gawin last minute talaga. Tips on tooth carving. But the most important is that do not overcarve. Kasi pag na-overcarve mo yan, like what I said, for example, yung teeth model mo, there is the specified measurements per tooth kasi. Kailangan mo masunod din yung measurements, not just the looks and not the aesthetics lang. So that's how we weigh it out in dentistry. Measurements and aesthetics, the anatomy of the tooth. Even though you're going slowly, kaya mo pa namang bawas-bawasan yan. Pero pag na-overcarve ka na, you have to do it again. You have to start from zero. So it's much better to go slowly and surely rather than repeating the same process all over again. After doing your tooth carving, when everything is polished and done na, hindi pa doon natatapos yung challenge or yung work mo. Kasi you have to take pictures pa. And when you take pictures, you make sure that all the details are clear. Like, crystal clear. Kasi makita dyan yung mga ridges, marginal ridges, and all the lobes. Kailangan every details is prominent. So, syempre, yung struggle, like, yung ilaw mo, kailangan naka-focus doon, na kailangan kita talaga yung details. So, minsan pa nga pag nagpipicture ako, kunwari na dito yung tooth, tapos pipicture ako ganyan. Di pa ako humihinga. Parang hindi siya nagalaw. Like, okay, yan. Tapos, parang mawawalan ka na lang ng hindi na. Kasi, that's the struggle talaga. Like, grabe. Pinagdaanan ko sa tooth carving. And for me, it was worth it kasi I was able to get a good grade on that oral anatomy. So when it comes to oral anatomy, there is drawing and then there is tooth carving. Kapag alam mong tagilid ka or you're having a hard time with the tooth carving, you make sure na you're gonna make it up sa drawing. But do not take the drawing easily because you also have to give attention to the details and to the measurement itself. We are now proceeding to the dental materials. So the last question is, where did you buy your dental materials? I bought all my dental materials at MedSurDent initially, and then yung mga wala sa MedSurDent, I bought it from First Dent. So I'm just gonna be linking all their FB pages and IG or Instagram account at the description boxes there below. This is the time where I am gonna be showing and sharing to you how I organize and fix my dental materials. Okay, so the first rolly organizer that I bought is a mix of metal and a hard plastic basket. But then later on, after a week, I saw in Shopee that there is all metal rolly organizer. And in my opinion lang naman, I think it's more durable and I can use it for a long time since it's all metal. The first rolly organizer that I had is binenta ko siya sa friend ko na dentistry student. So right now, I'm gonna be showing to you how I organize my dental materials. So like right now, this is how it looks like. Sorry, ang gulo. As you can see, this is my study table. So this is like my study room na din. And I'm gonna show to you my first rolling organizer. that I bought from local IG shop. So I'm just gonna be linking where I got this gold detail table, and it's really nice because it matches with all this storage